Hello, everyone. Thank you very much for attending our American Acupuncture Council webinar presentation. My name is Matt Callison. I'm here with my esteemed colleague, Brian Lau.
Hey, thank you, Matt.
We've got a really fun topic today. It's proprioception at Extrapoint, Chonggu. Brian, can we go ahead and go to that first header
Yeah,
slide?
so let's get the slide up. There we
There we
go.
go. So what we're going to be discussing is a needle technique for Extrapoint Chonggu, which is actually just one portion of a treatment for a upper cross syndrome posture. The upper cross syndrome posture, which we're going to be elaborating here in just a little bit, can lead to a multitude of different injuries. In today's very short presentation, we're going to be lecturing about how to actually needle this particular point and stimulate these lower cervical area that usually has a proprioceptive deficiency from this particular posture of a forward head and upper cross syndrome. So let's go ahead and I think jump right into upper cross syndrome so we can discuss that. So this term upper cross syndrome was coined by Vladimir Yanda close to 40 years ago. He is an osteopath and specializing in rehabilitative medicine. And he coined this term basically from looking at his patients that have a very unique type of posture that we actually see in our practice, and you as well, commonly, I would say every single day. It is looking at a forward head posture of a plumb line, increased thoracic kyphosis, so you can see that upper back really starting to curve. With that forward head, that's going to lead to a number of different postural imbalances and agonist antagonist. So Vladimir Yanda, when he saw this, he actually coined this term as looking at it as a cross. So you can see that the pectorals in purple here, the pectorals are going to be in a locked short position, pulling on that humerus, making the humerus internally rotate, collapsing the chest. Now going through that, you can see the next purple would be the neck extensors. Now those neck extensors are locked short, but they're actually through evolution looking at portions of these neck extensors are going to be locked short, and some of them will actually be locked long. The longer part, let's say the lower cervical aspect of that posture, you'll see that the neck extensors will be more in a lengthened position because of the forward head. Then the upper cervical region, the neck extensors, will actually be in a shortened position. So a little bit more on that with the next slide in just a little bit. So that's the purple aspect. Those are your locked short muscles. Now your locked long muscles will be, if you can see where the increased thoracic kyphosis would be your rhomboids, your middle trapezius, your lower trapezius. Those muscles will be very, very weak, allowing scapular protraction as well as that increased thoracic kyphosis. Now if we look on the anterior aspect of the body, you see the neck flexors. So it's the deep neck flexors in particular that are going to be that locked, long, or inhibited posture. If we look at the sternocleidomastoid, which will also be a neck flexor, that would be more in a locked short position. So you have your general upper cross syndrome, but there's also going to be just some variabilities within those muscle groups that will be locked long and locked short. So the takeaway here is to look at as today's presentation is that lower cervical region will be usually proprioceptive deficient in that forward head posture. It's a lengthened area. So we're going to use an acupuncture needle to try to reestablish some of that proprioception combined with an exercise to bring that forward head back to neutral position. Let's look at a couple of models here. Let's go to the next slide there, B. So zeroing in on this upper cross syndrome, a common posture that lengthens the lower cervical region, so you can see how the head is really quite forward, but then it's going to compress the tissues of the upper cervical region. So if you can take two fingers and just put them right there at gallbladder 20. And once you have that, just simply start to look toward the ceiling. You might tilt the head back just a little bit. That's called capital extension. So that's different than cervical extension. Cervical extension is when you have all of the cervicals moving. Capital extension, when you had your fingers there at gallbladder 20, you might have felt those muscles just move just a little bit when you're looking up. That's going to be looking at the upper neck extensors, especially the suboccipital triangle. Now when those muscles get really quite taut, That can lead to a number of different types of headaches, nerve entrapment syndromes of the third occipital nerve, the greater occipital nerve, the suboccipital nerve. Lots of different injuries that can occur from this particular posture. So you can see with both these models, they got increased thoracic kyphosis, the head goes forward, and as a compensation for that forward head, the person's just going to tilt their head slightly upwards so they can see the horizon line, and that's going to cause that capital extension and a number of different injuries. Now, Brian's going to go ahead and show a video that he did of himself to explain this a little bit more. Brian, do you want to take that away?
Yeah, sure. So video is just showing the relationship between the shoulder girdle movement, the scapular movement, and the spine. So there's a ton of sinew channels that act on the position of the scapula and the movement of the scapula. Not a ton, but there's several. Um, and we could go through them, but really I just wanted to highlight in this video how the spinal movement links with those scapular movements. And just in to tie into what we're seeing in these images here before we go into the video, these models, as you see, have kind of increased thoracic kyphosis. So their spine in that thoracic region and the lower cervical region, the spine is stuck in flexion. So we're going to look at the relationship between the flexion and extension components of the spine and how that relates to the scapular movement. Pretty short video. It's kind of an Instagram video. It's going to be on our Instagram channel. Or Instagram page, so it's kind of a minute long. Instagram doesn't give you a whole lot of time for these things, but it's very brief. So let's give it a look at.
Hey there, we're going to look at the relationship of the spine to the shoulder blade movement using this resistance band. So as I go from protraction into retraction, that movement likes to occur as the spine comes out of flexion and the cervical spine starts drawing back. So go back to protraction, you see that the spine will want to go into flexion, and then retraction, the spine comes out of flexion, cervical spine draws back. So many people have a forward head posture, so the spinal movement's not coordinating with the entire movement of the body. That sets them up for injury in the cervical spine, shoulder girdle, potential jaw problems, headaches. So they need to learn how to draw that cervical spine back to encourage the entire movement.
All right, so kind of I'm going to go back here for a second. Kind of a fun thing about filming things is you notice aspects that you wouldn't notice otherwise. I had my mic here on the shirt, so when my head goes forward, of course I go a little ways away from the mic. But I was acutely aware of how different my voice was and how strained my voice became when I went into that forward head posture. So that was quite interesting. But yeah, just also noticing the different tension in the extensor suboccipital region and how that sets you up for a whole host of different potential problems. But with that video, you might notice the scapular movement and how much activity there occurs in the rhomboids lower trap, as Matt was mentioning, those structures that are pulling the scapula back in retraction. So that can kind of get us thinking about ways of treating this beyond just the technique we're going to be highlighting. And I think Matt's going to get into that on the next slide here.
Okay, thanks, Brian. That was good. So just as an overview, what we're looking at is just a portion of that upper cross syndrome. The increased thoracic kyphosis, which is going to have a locked, long, and weakened, inhibited rhomboids, middle trapezius, lower trapezius. The head is going to be forward, which is going to be a lengthening of those lower cervical vertebrae. Then you have a shortening of the upper cervical tissues. So in this image, the head is neutral. Now, if we could be able to take that head and just move it forward, we can start to see a little bit more of how the lower cervical vertebrae going forward and how it would be great if there was a way for us to actually pull that lower segment of the cervical vertebra and all of the tissues that are highly proprioceptive, your deep paraspinal muscles, your supraspinous ligament, your interspinous ligament, and encourage that to be able to come back while the person is trying to strengthen the rhomboids, the lower trapezius, the middle trapezius, and add proprioception, add chi to that particular part of the spine. So I would say probably about 15 years ago or so, I started playing around with this needle technique with the exercise And the combination is pretty profound. And this is the reason why we wanted to share that with you today. Again, the takeaway here is just, this is one portion of the needle techniques, or the points that we would be using and the exercises that we'd be using for upper cross syndrome and forward head and increased thoracic kyphosis. But it is a pearl. This is a big point. This is a great technique to be able to use. So it's underneath the C6 vertebra. You're inserting the needle through the skin, through the superficial fascia, the adipose tissue. And then the first tissue of resistance that you'll feel would be the supraspinous ligament. Now, once you go through that supraspinous ligament, then the very long and wide interspinous ligament is going to be the next tissue of resistance that you'll feel with that acupuncture needle. On most people, it'll be probably just about a 1-inch needle insertion, which is completely safe. You're very, very far away from the spinal cord. Some patients, when they're laying on the table prone, it's kind of difficult to get to that C6 area because maybe they have a lot of tissue in the area, or are just increased extension for some patients. Some practitioners like to lower the head to be able to open up that neck. Personally, as a patient, I don't care for that very much. Having my head drop down a little bit doesn't feel very good to me. Usually what I'll do for patients is just to put a pillow underneath the chest, and that'll open up the neck. So as a practitioner, just take your finger or 2 fingers and start feeling underneath that C6 vertebra, separating the tissue so you can get an idea on how to be able to put that needle up underneath the spinous process of C6 and get through those aforementioned tissues. Once you get it into that interspinous ligament, which is about, like I said, about 1 inch deep, propagate chi. And it may take a while actually for that patient to get chi because of the lack of proprioception. Now remember, this is also going to be combined with other points, like for example, the rhomboid motor point, the middle trapezius rotor point, the lower trapezius motor point. You could use GB21, GB20. There's a number of different points that we can use depending on the patient's case. So once you're able to get an established chi at Extrapoint Chonggu, then what we'll do, we'll wrap the tissue around the needle by twisting the needle in one direction until the needle starts to get stuck. Once it's stuck, then we're gently going to start to pull that tissue back posterior where it belongs. So we want that tissue to go back. It's lengthened because of the forward head position. We want that tissue to go back at the same time as the person doing an exercise, the prone neck retraction exercise. So let's go to the next slide there, B. All right, so as that person is elongating that lower aspect of the cervical spine, bringing it back into extension, you're pulling up with the needle so they can start to get an understanding of raising that lower cervical part of their body up toward the ceiling. They're going to slowly just start to tuck their chin a little bit, so that starts to get rid of some of that capital extension. And they set up this exercise by lowering and squeezing the scapulas together, then engaging the middle trapezius, the rhomboids, and the lower trapezius. So this is an exercise that you would do after all of the needles have been taken out, with the exception of Extrapoint Chonggu. So Brian, is there anything that you wanted to add to that before we jump right into the video to show this?
Yeah, you'll see this a little bit on the video coming up. That the tendency for the people who really need this technique in particular, the tendency when people start to lift their chest by engaging the rhomboids, middle, lower traps, they're really tied into the idea, not even consciously, but just their body's kind of stuck in a particular position where they want to arch their neck up and exaggerate the neck position that we're trying to get them out of. It's just something that's very difficult for people who really need this technique. It's difficult for them to find that movement where they both retract the scapula and draw the cervical spine back and lengthen that posterior portion of the cervical spine, especially the upper cervicals. And now, of course, the technique is designed to help with that, to help give them a signal and encourage it. But you have to look at the patient and make sure that they're not going further into capital extension, kind of like trying to lift up and going further into capital extension. So you have to coach them. Now, the good news is the technique helps kind of give a little cue and coach them at the same time. But sometimes verbally coaching is necessary. And you'll see an example of that coming up here.
Yeah, that's a really good point. A lot of people will go into that capital extension just because they're used to doing that. So thanks for saying that, Brian.
Mhm.
By coaching the person just to tuck their chin a little bit, that helps with it. Now, this technique also is useful if you didn't want to needle it by just pinching the tissue of Chonggu and lifting that up. But it's not as successful, in my own opinion, as actually using a stainless steel needle going into the interspinous ligament, propagating qi. To me, that's then changing proprioception far better than just actually just lifting up that skin. Cool. All right, so let's
Yeah,
take a
yeah,
look at
you're
the
in the
video.
dew channel, right? With the needle, you're in the dew channel. You're in the ligamentous tissue, and you have a lot more sway on it. All right, so you ready for the video?
Yes. Yes.
Supraspinous ligament, interspinous ligament, the new density. So that's an inch and a half needle. Okay, so then now twist it. Okay, lower and squeeze scapulas together, please. Bring the heads together and relax everything. Okay. So bring these guys to your back pockets if you would. Good. And then squeeze this together. Nice. Okay. Twisting this. Tuck your chin just a little bit for me, and then bring this up to the ceiling. Good. Breathing. And good. Perfect. And down and relax.
All
Okay.
right, that video is up on our YouTube channel, by the way. So if I notice the birds are a little aggressive there, Matt, in your background, they're making some noise, so I might not have heard everything. The sound was a
Okay.
little put out by that, but we do have that up on our YouTube channel if you wanted to check that out, Sports Medicine Acupuncture, and you can
This was a
review that video.
recording. Oh, sorry, Brian.
Yeah,
Are
I'm
you
done.
finished? Can I go? Okay.
Yep.
This was a recording that we just did in New Jersey to finish the 2019-2022 SMAC program. It was 3 years because of the SMAC. I'm sorry, because of the COVID hiccup. So we just finished this. This was module 4, neck, shoulder, and upper extremity. This is one of the techniques that we're using. Now remember, we're also going to be needling the other points as well, and that helps with proprioception. So the person gets an idea on how to be able to lower and squeeze the scapulas together. So that's great. This is a really wonderful technique to be able to use. We're going to be teaching this class again here in San Diego, and that's coming up in June, 4 days, and that will be wrapping up completely the 2022 program. So also what we're going to be teaching with this is a wonderful myofascial technique that Brian has introduced into the program that works extremely well for that particular posture and opens up the tissue. A great myofascial technique to use after all of the needling. Brian, do you want to take it away?
Yeah, sure. So this is a seated technique. It's interactive between you and the patient. So first and foremost, you want the patient sitting in a position that is going to help facilitate change in the body. So you don't want them just slouching. Though I am starting a little slouch. So if you look at the picture, there's 3 images. The leftmost image, once you have the person sort of stacked on their sit bones, you're going to take your loose kind of knuckles. I usually use just the flat kind of inner phalanx of 2 fingers, and you're going to place that approximately GB20. I'm not being really exact on any location, really whatever real estate you can get in that upper cervical spine. And you want to allow the patient to drop their chest and go into capital extension. Why am I doing that? I'm doing that so that the tissue shortens and I can get a good investment of the tissue. I can kind of hook. I can engage the fascia. I can sink into the fascia. And then you're coaching the patient to start to lift the sternum, descend the scapula by engaging the rhomboids, lower traps, and drawing the cervical spine back so they're elongating the posterior part of the cervical region, especially those lower cervical structures that we're trying to engage. So they're doing that while you're descending and gliding through the tissue. So again, just initial setup, they drop, they exaggerate the posture so you can get a hook on the tissue. And then as you're drawing that tissue down and elongating, they're doing the movement, bringing the cervical spine back and opening the chest. So you'll see that in the technique. These just give you the kind of rundown and the instructions for that, but let's look at the video itself.
This technique is a combination between the manual work that you're doing and also the movement of the patient. So you want to coach them with the movement first of all. So have them drop the chest and cervical extension. So that's going to be the starting position, kind of starting them with bad posture. And then they lift the chest and lengthen the posterior cervical spine. So they start in extension with the chest dropped, and then lift the sternum, lengthen the back of the neck, the chin comes in. Many times patients will have a difficult time doing that. When they go to lift the sternum, they'll also go more into extension. So some patients, you have to coach them. So the movement of this technique is really a big part of it. So starting them in this position. So let's come back to neutral. I'm going to gently place my fingers up towards the occiput, just any area of the cervical spine that I have access to. I'm going to take them into the starting position. That'll shorten the tissue. It'll allow me to get a purchase of the tissue. And now it's a pin, and they start to come out of that, and I'm stretching the tissue in the posterior cervical spine associated with the urinary bladder junction. Another pass, maybe slightly lateral or slightly medial. So again, place your fingers on the neck, take them into the starting position. That allows me to get a hook, allows me to get a hold of the tissue because it's in a short position. And now as I bring the tissue downward, they come out of that position, lifting the sternum, bringing the chin in, lengthening the posterior part of the neck, and I can take it all the way down through the upper part of the thoracic spine.
All right, so this is a supine version. I guess we have the time, we'll watch it too.
To the seated extensor technique. So in this one, with the patient supine, we kind of limit the ability for them to be as involved in it by dropping the chest, by lifting the head. So it takes away a little bit of the re-education aspect, but at the same time, their neck's a little bit more relaxed, so they're in a more neutral position that way. I can still take them into capital extension. With them in capital extension, I can sink into the tissue pretty close to the occiput. And as I bring the tissue down and start spreading downward, I can bring their neck back into a neutral position. So it's a little more passive on the patient's part than the seated version. So it might be appropriate if there was currently neck pain that they were having a harder time in the seated position, or if you just don't have time to put them into a seated position and want to use the time otherwise. So 2 movements, one with the hand where you're bringing them into flexion and lengthening the posterior part of the neck. The other one with the other hand simultaneous where you're spreading downward, descending the UB jingjin.
All right, so a question about how many times or how long would you do this technique? It's a short technique, 2 passes, 3 passes. You don't need to do it really more than 3 passes. If I were doing multiple passes, I would probably move slightly lateral or slightly medial and cover kind of the same region, but tissue that's slightly medial to the first pass or slightly lateral to the first pass. These are short techniques. They're a supplement to the acupuncture. They don't need to be something you spend a lot of time with. Something else, especially with the seated technique, that might not be apparent, is when I was following the person as they went into that kind of exaggerated drop chest capital extension. I'm not cramming, I'm not digging my hand in as deep as I can. I'm really just following. It's more of a pivot point. Is you're guiding them and following. You're not trying to force them into that position. So I'm not using a lot of pressure. Um, by doing that, I get a hook on the tissue, and the pressure really comes from when they start coming out of that position. So you don't need to use a whole strong ton of pressure with it. It's a pretty gentle technique. There's force there; they'll feel it, but it's not anything that you're driving them in or trying to sort of like mobilize the spine by doing it. So it's more just following. All
Hey,
right.
Brian, I also saw that same question about the needle technique, so I think I'll go ahead and address that as well.
Sure.
Do you want to go to the next slide just so people can see that information?
Sure. So there we go.
Okay.
It just has our information. That YouTube channel, we have a lot of these videos up there. We also post them on our Instagram account and Facebook page. So all sports medicine acupuncture, if you search for that, you'll find it. And then our webpage is there also.
So to address the question about how often are you using the Chonggu lifting technique, until the patient actually has a really good command of the movement of going into prone neck retraction. Once they have that, then you can go ahead and stop. Now, so we address this needling technique as basically for that forward head, but you can also use this point for disc problems, cervical disc problems. Also, if there's going to be tenderness in just in that local area, if there's an ossuary point, you can also just go ahead and needle that without actually the lifting technique. The lifting technique is for when you see that forward head posture. But again, this point can be used for a number of different types of local injuries. Brian, is there anything else that you want to add before we head off?
Just to bounce off what you said, yeah, it's kind of used when they have that forward head posture. It might also be used when you say use that neck extension exercise that we highlighted, and the person's really struggling and they can't figure out how to coordinate that movement to bring that portion of the spine back. It's very difficult. And actually, I teach some online qigong classes. I was covering this today because there's people that do that very thing when they go to open the chest. They arch the neck up, and you try to coach them, and they have a very difficult time finding that region. So it's a proprioceptive technique. It kind of gives that a pointer to this tissue, bring this back. Without using words, they can feel that needle kind of pulling that region. It's like, oh, that's what you're asking me to do. You're asking me to bring that back. It becomes very clear. It's like a spotlight on that region. So you can just use the technique, but you might use it when you're seeing people struggle with particular instruction that you're giving them.
Well, you guys, that wraps it all up. If you have any questions whatsoever for Brian or myself, or you're interested in the program or any of our classes and information, there's our contact information that's there in those notes. Thank you so much for attending. Really, really appreciate it. Remember, next week, also, Sam Collins is going to end up being here. Thank you again for the American Acupuncture Council, and we'll see you again next month.
Yes, awesome. Thanks, everyone.
Thanks, everybody.